So my name's Victoria Harvey. I'm one of the haematology consultants, and I'm part of a team of consultants. There's 8 of us all together, and we work across 3 sites at Sunderland Hospital, South Tyneside Hospital, and also the Queen Elizabeth Hospital in Gateshead. We treat all types of blood cancers, and that includes all types of lymphoma, all types of leukemia, and myeloma. We get referrals from GPs and also from other specialties within the hospital trusts. So some of the blood cancers that we diagnosed can be diagnosed just by blood test. Some patients need a bone marrow biopsy to get an answer of what's going on, and some patients need a biopsy of an abnormal growth or an enlarged lymph gland, which can either be felt when you come to clinic and you're examined by a doctor, or it's something that we can only see on a CT scan. The tests that we do to diagnose your cancer generally take at least 2 weeks to get all the results through. And this is because we do highly complex and detailed testing to get the final diagnosis. And it can feel like quite a long wait to get all these final results through. Our patients with lymphoma often need a couple of different scans as part of working out the stage of their disease. So these scans would include a CT scan at your local hospital, and also some patients may need an additional PET scan, which is done usually at the Freeman Hospital in Newcastle. Because of all these scans, and because the tissue biopsies can take up to a couple of weeks, this means that we may not have all the results through when you come for your first clinic visit. So all of our patients with a cancer diagnosis are discussed in our multidisciplinary team meeting. This is where we have a discussion with our radiology doctors, some radiotherapy doctors, and also our pathologists, as well as all the haematologists as part of our team. The multidisciplinary team would recommend a treatment plan together with your consultant to work out the best treatment for you. It should be noted that not all blood cancers need treatment initially. Those patients would start what's called a watchful waiting pathway, where we monitor their cancer closely in the blood clinic. Our patients that do need to start treatment, the treatment is usually in the form of chemotherapy. So our chemotherapy treatment can vary a lot, and it very much depends on your type of cancer and your personal health. Chemotherapy can be tablet-based, and that can be given as an outpatient on any of our sites. Some chemotherapy regimes have to be given by injection and are given on our chemotherapy day units. We have chemotherapy day units on all 3 sites: Queen Elizabeth Hospital, Gateshead, South Tyneside Hospital, and Sunderland Hospital. Some chemotherapy regimes can only be given as an inpatient. For these patients, we would plan to admit you to our ward, which is B28 at Sunderland Royal. Some chemotherapy regimes can only safely be given at Sunderland rather than at South Tyneside or at Gateshead. If you live in South Tyneside or Gateshead, we may recommend that you have treatment at Sunderland. So all of our patients will be allocated a specialist nurse at the time of their diagnosis. You'll be given a lot of information to take home with you, as well as contact numbers for our specialist nursing team, but also our day units. We'd recommend that you read the information that you're given and write down questions as you think of them. And if you have any concerns at all or any questions, please ring us. The specialist nurses have an answer machine, so they may well not be able to answer your phone call immediately, so please leave a message and they will endeavour to get back to you within the same day.